Is a low-carb, ketosis diet safe and helpful for type 1 diabetes? Can this be done without insulin or with insulin? Some studies say it helps with weight loss and better sugar control, possibly reducing harm to blood vessels over time. But there are risks like dyslipidemia, diabetic ketoacidosis, and low blood sugar, so we need to be careful and study more. You can see the link to the original article in the link above or in the description. We will explain the two terms dyslipidemia and ketoacidosis. Dyslipidemia usually means your LDL levels or your triglycerides are too high. It can also mean your HDL levels are too low. Diabetic ketoacidosis, also known as DKA. When there is a severe lack of insulin in the body, so it can't use sugar for energy. When this happens, chemicals called ketones are released. If left unchecked, ketones can build up and make your blood acidic, hence the name ketoacidosis. Low-carb or ketogenic diets can be high in fat, moderate in protein, and low in carbs. They need to be well planned for good nutrition and health. These diets might help control blood sugar and improve heart health in type 1 diabetes patients. But, we must be careful about problems like dyslipidemia, diabetic ketoacidosis, and low blood sugar. People on insulin need to adjust it when starting this diet and be closely watched. Some medications need to be stopped, but others, like metformin, seem safe. Example case of a 31-year-old man with type 1 diabetes tried a low-carb diet. Before, he used an insulin pump and did not have very good control. After 6 months on the pump, his control was still not great, A1C 7.7%. So, he tried a very low-carb diet and adjusted his pump. He said his control improved with less low blood sugar. His A1C came down to 5.7%, and he weighed 18 pounds less than previously. Before starting on the keto diet, his body mass index was 30.4 kilograms/m2, which is considered a fairly high value. Glucose levels were reported as within the desired range 3.9 to 10.0 millimoles/L or 70 to 180 milligrams/dL as per American System 97% of the time. He needed a very few amount of insulin. The patient inquired if this dieting program was safe in patients with type 1 diabetes. While we are in the middle of the video, do not forget to hit the like button. See the description and comments for references. We would appreciate your comments. Ketogenic diets have risen in popularity in recent years as a plan or method for weight loss and treatment of a variety of diseases. For patients with type 2 diabetes mellitus, the diet can lead to clinical improvement, including better sugar control, lower cholesterol, and weight reduction. The diet is also becoming popular among patients with type 1 diabetes, but its clinical impact remains unclear, as much of the literature consists of retrospective case reports and series. The subject has not been well investigated, likely because of concern about inducing ketoacidosis and hypoglycemia in patients already at high risk for these complications. There are simple tests you can do at home to check the ketone levels in your urine. You can buy this kind of test at your local drugstore or pharmacy and do it at home. High ketones in urine may indicate high ketones in blood, which is a safety issue. Talk with your doctor or healthcare provider about what levels of ketones are allowed in your blood. You have the right to change your doctor if he or she is not interested in your health but is more on commission from drug and pharma companies. Ketogenic diets are mostly high in fat. That is 60% to 85% fat, moderate in protein 15% to 30%, and low in carbohydrates 5% to 10%. This makes the body use fat as its main energy source. To figure out how much food and what kind of nutrients a person needs, you can use formulas like Mifflin-St. Jeor. However, there's a bit of confusion in the literature about what exactly a ketogenic or very low carbohydrate diet is. Some say it's 20 to 50 grams of carbs per day, or less than 10% of all the energy you need. Some people think that if you follow a ketogenic diet, you can't eat many vegetables and must eat lots of meat. But a good diet can have a mix of protein containing foods like legumes, beans, fish, cheese, and Greek-style yogurt. You can also have 4 or 5 servings of low-carbohydrate vegetables each day, providing about 20 to 30 grams of carbs in total. So, all the allowed carbs can come from vegetables. You can get fat from plants, fish and avocados like those in the Mediterranean diet. Mediterranean diet includes olives, nuts, seeds, avocado, tuna, and salmon. If you plan to stick to a ketogenic diet for a long time, make sure it meets all your nutritional needs. A study showed that a low-carb, high-fat diet with 10% of calories from carbs can provide all the necessary micronutrients. Also, getting advice on nutrition and staying hydrated can help you get the right amount of electrolytes like sodium, potassium, and magnesium. Do not forget to click the like button. Thanks very much for watching this video. Up above you see 2 videos related to health. It will be more helpful to you and your family. See you in the next video.